A very good afternoon and greetings from AVP Research Foundation. As you all know that AVP Research Foundation is a premier Ayurveda institute engaged in research, education, and practice of Ayurveda from inspired from the roots of classical Ayurveda practice and for almost 2 decades, we at AVP Research Foundation is trying to follow scientific practice-based evidence. When we talk about how to create evidence, we have been pioneers in doing that by documenting each and every case. And we were one of the first institution in Ayurveda to have started computerization for the documentation and practicing a very evidence-based approach to managing different kinds of disorders. So today we are going to discuss one of the very important disease or disorders of uh, uh, veins, and it is nothing else than varicose veins and its complication of varicose ulcers. We are quite astonished to see that for last 5 years, the number of patients suffering from the varicose ulcers have been increasingly coming to Ayurvedic clinics. And it's quite interesting to know that what could be the reason. That means obviously there is a gap in conventional contemporary management of varicose veins, which tends to attract people to Ayurveda. So first, let us understand what is varicose veins. So if you have twisted, swollen, or enlarged veins, usually in the legs, basically profoundly it is seen in the legs that uh, there are tortuous, swollen veins in the legs, often bluish in color many a times. And it is basically result from the weakening or damage of walls of the vein. And the symptoms of this disease is basically rest pain. So many a time when you go to the sleep, when you are sleeping, then the pain aggravates. So it also kind of impacts the quality of life. So rest pain is one of the major symptom of varicose veins. Then heaviness of the legs. That's another important symptom. Swelling in the legs because there is failure or damage of the walls of the vein, the venal flow is suboptimal, and so there is a stasis. So the fluid or the blood tends to, because of the gravity, accumulate around lower dependent parts of the body. So they have swelling. And then if there is no proper blood flow in the venous system, obviously it then leads to deoxygenated blood accumulation and many other toxins accumulating into the lower limb. And that's how the peripheral discoloration happens. So skin discoloration happens. So the modern risk factors for these varicose vein is said to be, first is Sahaja or called as age factor. So with aging, if people are not engaged in proper toning of the lower limb muscles, or they are not doing exercises, or they just sit in a specific posture, they tend to develop this disease faster. Second is obesity. It is one of the major lifestyle causes for varicose veins, because today we see, with affluence and India becoming developing country, one of the major brunt what we are facing is from the lifestyle disorder, and obesity is one of them, and this is also one of the factor for developing varicose veins ulcer. And also pregnancy. So many a time, especially in women, early signs of varicose veins tends to start with the pregnancy period in women. One more important observation we have made clinical is that people who are prone to piles and prolapse pile or different grades of pile, they also have a chance to develop varicose veins in due course of time, because again it's a venous engorgement pathology. One of the very important uh, understanding of varicose veins has been, it's called also as conductor disease, like bus conductors get, because of either they sit for long time or they stand for a long time. So what is important is, when you are in a specific posture where your gravitational force in your blood circulation acts in a specific direction for long time without change in your posture, it also helps to, it leads to kind of developing a varicose veins. So let us talk about why people are getting attracted to Ayurveda for this disease, and what is the Ayurvedic perspective of varicose veins. There's a very important reference in Ayurvedic text called as Siraja Granthi. Sira is one of the Upadhatus, and Ayurveda term that Siraja Granthi can be appropriately correlated to this condition. Now, what is the most important information what we get is the pradhana dosha, the main dosha behind varicose veins, of course, is Vata, because it first is below the Nabhi region it happens. So this is primarily a Vata sthana, as well as what we see is the circulation of the blood gets impacted because of the failure of the walls of the veins. So, of course, the gati of the vata gets impacted, and here we see apravritti is there, or heen pravritti of the vata is there. And then, if you talk about dhatus, it is basically Rakta Dhatu and Mamsa Dhatu involvement. As we know, Sira is one of the Upadhatus of Rakta. So, obviously, the inability of purifying your Rakta properly, that means Rakta is also an important dhatu which gives jivana. It gives also the necessary oxygenation to the whole body, or different parts of your organ, that gets vitiated. So this is very important, that when you talk about management of varicose veins, it's not just a local phenomena. You need to talk about the whole Rakta-Vahasrotas, and the base or the mula of Rakta-Vahasrotas is again Yakrit Pliha. And we need to, when we talk about the management of varicose veins from an Ayurvedic perspective of Samprapti, it does not only restrict to applying some oil or giving some symptomatic treatment, which is below the navel region or adho bhaga of our body, but also talk about a lot of impact has to be given to managing pitta and the rakta dhatu along with vata. So it's not just a vata dosha, though pradhan dosha we see is a vata involvement, but then Other important dosha is Pitta dosha, which you'll have to definitely take care of. Then, if you look at the basic etiology, what are the nidanas of varicose veins, if you talk about? So, of course, there are both nidanas. That is ati pravriti, when what we see, even if you the ati vyayama or avyayama, or you are always sitting in one posture, then the varicose vein incidence increases. Irregular food habit and lifestyle. So we know that all the nidanas which can increase the vata and pitta increasing. That means, for example, eating at irregular time. You will say, what hell? Just eating at irregular time impacts your varicose veins. No, it is, because when you eat on irregular time, you tend to create a lot of mismatch in your circadian rhythm. Thus, the gut metabolism alters, gut microflora is not proper, and then there is a lot of inflammation happening. And this inflammation travels to the Rakta Dhatu throughout the body and then creates such kind of localized symptoms, but it's in generalized in nature, which is connected to your irregular eating habit. Now, today we are also in the world of shift job, that we do lot of across time work where sometimes you see people sit continuously for 6 to 8 hours on their work, and that is a pravritti of vayu. That means you are not allowing a particular part of the body to have a proper flow of prana and vayu in that particular area, which is sedentary lifestyle, and also in irregular time hours. So when your body has to sleep, you just wake and then do a cross time job, and then this also tends to inflame your system. So what we would like to send a message is that varicose veins is not just a disease which is just due to the mechanical clauses of the flow of blood in a particular part of the body, but it's all much associated with a lot of modern diet and lifestyle. Because today, most of us are just uh, indulging in inflammatory diets, which is fast food, processed food, and also a lot of sedentary lifestyle, and not aligning our lifestyle into a circadian rhythm. Then, of course, it also comes is food which are very dry. See, today there's a culture of eating something which is fast, which is improperly good. Then, second, which is just dry or frozen. Dry, we eat dry fruits, and literally we eat dry fruits without soaking it. As we all know that eating dry fruits, when you soak or roast it, it is more scientifically valid because it balances the anti-nutrition body the factors into these nuts and pulses. Without knowing this, we just make a crunch of it, or we make energy bars. There's all lot of energy bars is coming, where this scientific process of neutralizing these anti-nutrition factors are not available. But you say, I'm taking enough calories, I am taking enough nutrition, but not knowing that they are not properly processed to address to your calorie or nutritional needs, because these factors are not taken in account in giving you all these fast food and processed food and ready to eat concept in the new lifestyle. So these all also tends to kind of uh, aggravate your vata and also the pitta in due course of time. Mental stress and lack of rest is also very important factor of increasing vata and pitta. We know that when you are mentally stressed and emotionally imbalanced, both these doshas tend to aggravate. And lack of rest. Today, we have so much fast-paced lifestyle, but if you don't take adequate measures like Abhyangam Nityam, actually, it's told in our Ayurvedic text that one way to undo this Vata flare up because of your continuous travel, lack of rest. Vata gets at least once or twice a week, apply some oil on your body and head so that this Vata can be taken care of. So these are some things which are cause of these varicose veins. Very simple, very general, but yet it is one of the, that's why I tell is varicose veins is not a disorder of vascular system, muscular circulatory system. It's a disorder which is emanating out of your own lifestyle. So, if you look at from an Ayurvedic perspective of Siraja Granthi, what are the lakshanas or symptoms told that are there are nodular swellings in the veins, siras, then there is pain, rujaha, shotha, swelling around and the dependal parts of the body, Krishna Varnata, discoloration of the skin. Then you have stambha, stiffness or heaviness in the legs, and klama, fatigue in the limbs. Because when you don't have good quality blood with adequate oxidation, nutritional enrichment, if it's not there enough, then you definitely feel a trend of having some fatigueness in the lower limbs. So let us come to, if this is the challenge today, how do we approach managing it from an Ayurvedic perspective? So first concept of Ayurveda is we need to clear Shodhana of the Srotas. So when you also talk about Nadi Shodhan Pranayama in yoga, what we do is that we do the Shodhana of the Nadi. Similarly, in Ayurvedic process, through different Panchkarma or Purva Karma techniques, we try to clear these channels. So, Shoto Shodhana is one of the first line of therapy. Now, we know the cause of varicose veins is not just the structure, it's not the Srotas, the structure, but it's the functional unit behind it is that is Vata and Pitta. So we need to also do therapies which will alleviate the Vata and Pitta samsarga in this. So we need to do nourishment of Rakta Dhatus. You have to purify first Shodhana and then Ropana of the Rakta Dhatus. And once that is done, so one of the best therapies we know for Pitta and Rakta is Virechana. And then subsequently doing Vatahara therapy, which one of the best therapies we know is Basti therapy. So these are very important therapies. And that too, when you are doing Basti therapy, there are combinations, dravyas, which needs to be utilized in doing the Basti process during the management of varicose veins should be Vata-Pitta Hara. And we know there are a lot of Chirvastis with Tiktarasa Sadhita dravyas, which are found to be very good in managing these samsarga of Vata-Pitta at the same time, also anulomana nature in the management of varicose veins and varicose ulcers. Talking about Raktamokshana, of course, Raktamokshana has been one of the Sthanika Shodhana process, that is localized purification is possible through Raktamokshana. And but you have to be clear that you should attempt this Raktamokshana in only cases where there is Dushvrana already formed. That means varicose ulceration is there, and then there are a lot of slough, dead tissues, and Dushvrana lakshanas are there. So in those cases, it is advisable to do Raktamokshana because we know that Jaluka or leech therapy tends to increase the peripheral circulation and uh, new capillarization, growth of new capillaries and blood vessels in the particular area. Then we need to, uh, as we talked about, indulge in therapies like Abhyanga, local application, where we need to kind of apply oil, seeing that if there is ulcer, you have to be careful that the management of ulcer, that particular local area has to be done with oils like Jatyadi Tailam, runner opener Tailam. There are a lot of other options which, based on dosha and dosha, you do. And then also hip downwards, use of Sahacharadi Tailam, Muruvena, because see, people don't understand the Muruvena is, though told in Chata and Chata Roga, in injury condition, vascular damage, microcapillary regeneration, as well as absorption of some primary thyla. Muruvena is an excellent formulation which goes along with to enhance the therapeutic efficacy. Of course, external lepa, you can, based on different kind of panchkal, valkala, uh, vargas, you can use as a lepa, nimba, haridra, karanja, aragvadha, which tends to have both rana shodhana and ropana property, and then manjishtadi gana lepa. So these are some things which you can use as lepana, and in our clinical experience, we have been following this. So all these guidelines we are talking about is not based on the mere thought process, based on theoretical understanding, but we have been practicing in AVP Research Foundation and creating a lot of clinical evidences for this, where these kind of therapies are already giving a lot of good results. Talking about importance of Nitya Virechana. See, in skin diseases and Twak Rogas, Nitya Virechana is a very important as therapy, because as we have already discussed, that Virechana is a very good pradhan therapy for Pitta, but also it has a quality of anulomatva. So it also tends to balance Vata by creating anulomatva, though it may not directly impact the Vata, but it improves the anulomatva, and that's why especially Rakta Dhatu purification and anulomatva. And anulomatva is very important for varicose vein ulcer, as because we know that anulomatva is the flow of vata or flow of prana in its own natural direction. So in a way, if the blood flow has to go from lower limb to heart, Virechana initiates such kind of process along with other uh, uh, you know uh, therapies combined with it. And of course, in this, very important that you need to do certain lymph drainage oriented exercises, asanas, or physiotherapy exercise, which could drain the fluid which is static in the lower limbs to into the general circulation, and that enhances the whole response and the time of healing of these varicose ulcers, or the symptoms is much kind of improved. Then when you come to different combinations, so I don't want to put out a lot of our just kind of biased approach, but what we can tell you based on our evidence-based practice, that Manjishtadi yogas, whether it is Brihat Manjishtadi Kwatha, Mahamanjishtadi Kashayam, or Manjishtadi Kashayam along with Sahacharadi Kashayam. See, these two, there are very interesting few basic preliminary research papers also getting published, and we are also in the way of publishing few case series on this. There, as I told you, Manjishtadi and Kaishoglu may initially look to be as one of the most prominent, you know, formulations which helps. But what we have found that even Sahacharadi, which we talk about Vata Vyadhi, which impacts the adho bhaga of your body, the lower half of your body, it's very important. So when you are using in combination, this approach not only improves the wound healing process or improves the discoloration and flow of blood or rakta shodhana, but also it improves the gati of the Rakta Dhatu or Vata gets reestablished in an Anuloma perspective. So never ignore there are all the Kashayas which are told for reducing Vata, especially in the lower limb. Again, very important thing is many of the uh, Kashayas which are told in the Arshas Chikitsa, like Churuvilvadi Kashayam, Sukumaram Kashayam, has to be also taken in account based on the Vyadhi Sakratvam, means the kind of comorbidity along with these conditions there you need to talk about. Of course, as we talk about Sira from perspective of Rakta Dhatu and Snayu, Mamsa, all those dhatus, we also get next is important is the Guglu Kalpanas. So Kaishor Guglu, of course, is the high diet. But at the same time, there are other kind of Guglu Kalpanas like Triyodashan Guglu. Then you have Grita Kalpanas, especially uh, Guglitiktakam Ghritam, when there is a chronic vrana, which slowly from the Rakta-Mamsa it gets into Asthi Manja. We need to use such kind of, when it is very chronic vrana because of the venous ulcer, such kind of Guglu Tiktakam Ghritam combination, Mahatiktakam Ghritam combination helps it. Now, when you come to uh, Sthanika management, of course, we need to see that vrana, if happens, or if there is no vrana, but there is a lot of discoloration and external application you have to do. So you have host of uh, formulations. Even Pindatailam is a very, because we know the uniqueness of Pindatailam since it's indicated in Vata Rakta Chikitsa. Management of, the pain in the varicose veins, ulcer cases, Sahacharadi Kashayam with Sahacharadi Tailam with Pindatailam has a very interesting impact. And in fact, we mix also Muruvana along with it to enhance the absorption. So these are very good for there is no wound. Yes, if there is a wound, then of course our one very important combination which we do is Jatyadi Tailam or Jatyadi Ghritam, which is a very go-to thing, and also our churnana with Nimbadi churnam. So these are very important that the secondary infection, whether it is on the top non-healing layer of the wound, is there, or we can use Nimbadi churna as for prachalana. If suppose the kapha dushta vrana stage is over and it becomes a shuddha vrana, then of course then do prakshalana either with Yashti Madhuvantam or with Panchavalkala Kashayam helps you to have a proper rohana and epithelialization of the wound thing. So I was telling you, we are not just kind of talking about this disease just based on our um, uh, kind of perspective, but we have treated a lot of such kind of varicose veins with complication with the varicose ulcers as well as without. So I'm just trying to show you two very interesting cases where, of course, we have achieved complete epithelialization, and both these cases has been suffering from this, varicose vein situation for more than 15 years and non-healing ulcers for more than 5 years. and they've gone to all the different contemporary therapies, but they didn't respond. And we can see that with our an average of 3 months of therapy, yes, we can't do magic in few days, but yes, in couple of months, definitely we can achieve. As you can see, in this case, we can achieve complete epithelialization. This is more difficult case of the varicose ulcer case, where a big portion of his leg was impacted, and this took at least to attain complete epithelialization. It took almost 8 months for us to now, I want to very clearly state that in this both cases, we have not used any allopathic medication. And what we have been seeing, that we have been able to manage both the secondary infections in these two cases, uh, even if there is some kind of fever symptoms during infective space stage. In all these cases, we have managed purely through Ayurveda therapy and managed these conditions. Uh, and very important thing in this, what we would like to tell you is that pain, when we handle such kind of wounds with secondary infection with varicose vein, pain management through Ayurveda is also possible. And here we have to talk about Vijaya Prayoga. That is the medical combinations or in Ayurvedic text made out of Vijaya. We all know. Of course, it's a very misunderstood word right now when we talk about marijuana or cannabis. But in Ayurvedic text, there are a lot of references told about Vijaya used in such kind of pain management, Varana conditions. So that we use in case of acute pain management when people are not having proper sleep, night sleep. Such prayogas, like Trilok Vijayavati, it's a classical formulation in Ayurveda, which is also a very good pain management, perspective. You can use it. So thank you for kind of um, getting to subscribe to our channel. I know we are trying to give the best practice based evidence to all our followers, and we will be very open to answer any of your queries. If you kind of give your um, suggestions in our YouTube chat box. We will get back to you and try to answer your queries. And please subscribe to our YouTube channel because your subscription will motivate us to make more and more authentic, very professional, and very serious evidence-based uh, cases, case series, and do a lot of research. It motivates us to keep doing the hard evidence-based practice, as inspired by our mentor P.R. Krishna Kumar ji, and AVP Research Foundation stands for that quality and care. Thank you so much for your patient hearing, and do join us for the next webinar, done by AVP Research Foundation. Thank you.